Oh, hello and welcome to the COVID-19 pandemic updates. I'm Kayode Okikelu. But first, the highlights. More federal government employees take the jab as unvaccinated workers are turned back from offices. UNAVDAC says it has met WHO benchmark requirements, gets laboratories ready. And the foreign scene still recovering from the Delta variant. India records first 2 cases of Omicron variant as Germany imposes strict curbs on the unvaccinated. Thank you for joining us today. The new Omicron variant has now been confirmed in 27 countries as of the last count, 5 of which are African countries, 14 are European. Let me just put it this way. Every continent now has at least 1 case of the Omicron variants. Well, scientists say it is still too early to know what we're up against, but we have some insight for you on the program today from a nation that has come up against a similar foe in recent times. But first, let's take a look at the latest COVID-19 figures.
52 additional persons in Nigeria have tested positive to COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 8 states and the FCT, indicating a drop from the figures reported earlier. Lagos logged the highest infections with 29 cases, while 12 cases were registered in the FCT. Other states logged a single-digit infection, including Kaduna with 4 cases, Bauchi had 3, Kano 2, while Ogun and Oyo had 1 case each. The new tally has increased the total confirmed cases in Nigeria to over 214,000. 8 patients have been discharged in the last 24 hours, increasing the total number of recoveries to 207,312. 1 additional death from COVID-19 complications was reported in the last 24 hours, raising the fatality toll to 2,978. More than 6.7 million eligible Nigerians targeted for COVID-19 vaccination have received their first dose, while over 3.6 million persons have been fully vaccinated. In Africa, there are more than 8.6 million confirmed cases and over 223,000 deaths recorded across countries on the continent. The total global confirmed cases have surpassed 263 million, while deaths are beyond 5.2 million.
2 of the vaccine mandate enforcement for federal government employees here in Nigeria who now have to show proof of vaccination or negative PCR test results to gain access to their workspaces. Well, that strategy seems to be working, as many federal civil servants are now obliging themselves to be vaccinated against COVID-19 at nearby centers, while others are asking the federal government to review the process of implementing this directive at the Presidential Steering Committee on COVID-19. Our correspondent, Empress Simon, reports.
This COVID-19 vaccination stand, situated meters away from the Federal Secretariat Abuja complex, began a mass vaccination exercise days before the December 1st deadline by the Presidential Steering Committee on COVID-19, which mandates all civil servants to present a vaccination card or evidence of a negative PCR test done within 72 hours before being allowed into their offices. Since the enforcement exercise commenced, more persons are coming to the stand to get vaccinated.
We have successfully vaccinated over 500 people since Monday, and today is on Thursday. So today too, we are looking forward to getting really good numbers.
While some of those who took the vaccine say they feel compelled to do so, others say it was a matter of volition.
Since government said we should take it, so we take it. If that will bring an end to the COVID, we have to abide.
I just felt now is just the best time to do it.
Meanwhile, enforcement of the federal government's directive continues, with many people restricted from gaining access to public facilities.
First and foremost, you should know the medical history of each and every one of your staff before you know who is eligible to collect this vaccine or not.
Those who are concerned should write to all the permanent secretaries in the country, particularly here in Abuja or wherever. The permanent secretaries will have the responsibility to inform all their staff.
Some question the conduct of those enforcing the directive.
You can imagine the security officials asking people to go back because of vaccination. Are they vaccinated? Do they have even their nose masks? They don't. So I don't know the criteria for all this. Do you understand? Because I don't believe you should force people to do this.
As the federal government insists on enforcing the directive by the Presidential Steering Committee on COVID-19, some of these civil servants want the implementation process reviewed. Emperor Simon, Channels Television News.
Well, the Director General of NAFDAC says Nigeria is on the verge of producing critical medicines, including COVID-19 vaccines, as the agency's huge investment in research and laboratory equipment is beginning to yield results. Professor Mojisola Adeyeye, who spoke on the achievements of NAFDAC under her stewardship in the last 4 years, notes that the agency has so far spent over 2 billion naira, in addition to the 997 million naira COVID-19 intervention fund, on equipping the laboratories.
Let me emphasize that promotion of local manufacturing has been on my priority list. This is to reverse the trend of the 70% import to 30% import. Through many self-audits, NAFDAC has met the expectations of the WHO global benchmarking requirements. I put a premium on the state of our labs. This directorate is the mainstay of our businesses as a regulatory agency. About 997 million of the COVID-19 intervention fund has been spent as we speak on the laboratory equipment. That is the vaccine lab that is being built. Over 2 billion naira worth of equipment have been procured. The National Drug Control Lab for vaccines and biologics got ISO certification in February of 2019.
Now bring you our lead foreign story. At about 12 noon local time today, India reported its first cases of the Omicron variant as 2 men in the southern state of Karnataka tested positive. Aged 46 and 66, both men are said to have just returned from overseas. Well, no severe symptoms have been reported in both patients, and the government says all primary and secondary contact of the 2 patients have been traced and are now being tested. For more on this developing story, we are joined by Dr. Vishal Rao, who is a member of the Genomic Surveillance Committee COVID Task Force in Karnataka, India, where the 2 cases were detected. He's also the Dean, Center for Academic Research, HCG Cancer Center. Thank you for joining us, Dr. Rao. You know, the last time we spoke, you were reminiscing on how India transitioned from being the epicenter of the Delta variant, but now 2 cases of the Omicron variant has been detected. First, I wonder if that triggers perhaps a flashback to the dark days of April and May. But at this point, really, what more can you tell us?
Thank you. I think the most important thing that we've had information from the WHO and many of our global experts from UK, USA and other countries has been that the potential of the Omicron cannot be underestimated. We know that the Omicron has more than 32 mutations compared to that of Delta, which has only about 16. Now, at this juncture, such spike protein mutations make it more transmissible, make it more potentially more virulent, and having a higher potential for vaccine escape mutations. Now, with this background, the data that we've gathered from Botswana, South Africa shows that most of the cases have been of a milder infection with no fatality, but the numbers are very, very less for us to kind of make some strong conclusions on the indolent nature of this particular virus. At this juncture, I think globally now there are more than 20 countries that are already on high alert with Omicron being detected, and India has also detected this. So this, I think, in one point reiterates to us that the war is far from over. I think the Indian government has re-emphasized the need for enhancing and accelerating the vaccination. We know that there is a race between the vaccine and the variant, and government of India and state governments are working neck to neck to ensure that maximum number of people are made responsible to take the second dose. And parallelly, we follow the transmission appropriate behavior.
Certainly dealing with the Delta variant will have increased India's capacity to handle this or perhaps any other future eventuality. But in terms of response now from the government, perhaps at the state and the federal level, what are the options on the table? I mean, we've seen countries, about 30 countries, tweaking, travel restrictions and bans here and there. But for India, what are the options on the table?
So the government of India has already issued an advisory to all the states. The current advisory warns the states about looking at a very, very strict vigil on all high-risk countries. But I think overall, each of the international airports have strengthened the vigilance, made COVID reports mandatory, COVID-19 PCR reports mandatory. And third, I think looking at quarantine, either home quarantine or institutional quarantine is being also asked for, even if you're COVID negative for a week. Now, these are steps that are done in order to protect any kind of further entry from international borders, but also at the local level, we've, I think, started work at every state government level to increase the preparation for beds, for manpower, and to look at a possible likelihood of any kind of a surprise. Now, this comes from the data that we've already had, for example, in Karnataka from Delta. Now, if you look at the scenario we got Delta picked up in December in India. And by March, we had a positivity rate of 0.5%. But by end of March, we had it at 5%. And by end of April, it was at 25%. So if you look at the trends of Delta, within 2 months, it could jump from 0.5 to 25. It is very, very crucial that we understand that if even Omicron is having a faster transmission than that of Delta, then we are expecting this jump to be faster. So the preparations are currently on for tracing, tracking, testing, but also emphasizing on teamwork at this juncture to ensure and better training for genomic surveillance.
Well, Dr. Rao, I see you coughing there. Can I put in one more question? Is that okay before we wrap up this?
Please.
Okay, so there's a new vaccine on the block, so to speak, for India. And I say this on the back of, you talking about vaccination being one of the key points that the government has been making. And this new vaccination, well, new, perhaps a lot of people have not heard about it. It's a DNA plasmid vaccine by Zydus Cadila. I think the name is ZyCoV-D. What can you tell us about this? I know India has gone quite well in terms of vaccination, but how much of a game changer is this really?
See, I think the Zydus seems to be a very promising DNA vaccine. We've got some very initial promising data from Zydus on this. But what currently we are grappling with is not the shortage of vaccines. It's but about dealing with the behavioral issues of people adopting to take the second dose, or some of them even the first dose. And I think this is an important behavioral intervention we are working towards, while I think the new vaccines will also play a key role to look at whether we can look at a heterogeneous mix for booster doses, and also to look at this as a new ray of hope for people who have not even taken the first dose. And I think this will also help us bridge the vaccine inequalities for many countries that are today grappling with shortage of vaccines.
Well, Dr. Vishal Rao, it's been a pleasure speaking with you. We'd like to thank you so much for taking time out to speak with us. I know that being a member of that Genomic Surveillance Committee means that you have a lot of work on your hands right now. I wish you the very best.
Thank you.
The federal government is asking states to key into the ongoing COVID-19 mass vaccination exercise in order to reach their target of vaccinating 70% of eligible population by January next year. The Minister of Health, Dr. Osage Hanire, made the appeal at the Special National Council on Health meeting in Abuja, where he also gave a progress report on the government's efforts to start manufacturing COVID-19 vaccines here in Nigeria.
Inequities in global distribution reduced the access of African countries and also some Asian and South American countries to a fair share of vaccines. As at 27th of November 2021, just over 6 million persons had received at least one dose of the COVID-19 vaccine in Nigeria, and 3.4 million persons were fully vaccinated with 2 doses. This is far from the 70% vaccination of eligible population that we want for herd immunity. A mass vaccination exercise aimed to reach 50% of eligible populations by end of January 2022 is underway. But vaccine skepticism is still an issue, and states have a role to play to develop local strategies to counter hesitancy and skepticism.
And now to Taraba State, where Governor Darius Ishaku is asking residents to be vigilant over the new variant of COVID-19 in this state and take the necessary precautionary measures to ensure their safety. The governor is insisting that all hands must be on deck to eradicate COVID-19 out of Nigeria, if truly Nigeria wants to survive it with the advent of the new Omicron variant.
And great you are.
Gathered here are medical personnel, politicians, sons and daughters of Taraba State to witness the official commissioning of the hospital meant for women and children. The hospital is also assisting COVID-19 vaccination of residents within the community, as well as treatment of ailments of children within the ages of 1 month to 18 years.
The initiative of the Emergency Medical Transport, EMT unit, affectionately called the Keke Ambulance Service. With limited resources in Taraba State, his support has been exceptional to create an enabling environment for us to serve and carry out our duties.
Nobody is safe against this virus until we are all safe. Please take the right precautions, wear your mask, socially distance, and wash your hands. But most importantly at this time, take the vaccines which are available in plenty.
The Minister of Health says the hospital will aid in flattening the curve of the pandemic, as it aligns with the vision of the President to ensure access to quality healthcare delivery to citizens.
These facilities fully align with the vision of the President of the Republic, who is also committed to improving access to quality healthcare for rural and vulnerable populations, with particular focus on women and children whose survival chances are greatly improved by such service provided here.
The state governor, Darius Ishaku, on his part, urges residents to take the COVID-19 vaccine, as he says it is safe and free.
I encourage you all to take the vaccine. I have already taken my own, the first and the second doses, and I'm still standing strong, hale and hearty, and I encourage everybody to take the vaccine.
With a call for increased vaccination, residents are hopeful that the new variant, which is said to be highly transmissible, will not lead to another lockdown.
For more on this, we're joined by Dr. Aminu Hassan, who's Executive Secretary, Primary Healthcare Development Agency in Taraba State. Mr. Hassan, I should say. Thank you for joining us on the program. Well, you've chaired the agency for quite some time, and this perhaps might be one of the biggest challenges you have faced. Bearing in mind that you're not just vaccinating against, COVID-19, there are other vaccinations against other diseases going on right now in the state. But for COVID-19 specifically, just how far have you been able to go in that regard?
Well, thank you very much for having me. So far, so good. Taraba State has done so much towards the vaccination of the eligible people in the state. If you can recall, we rolled out the first phase of the vaccination exercise, and we also subsequently rolled out the second phase of the vaccination. We have succeeded in vaccinating over 74,000 people with the Oxford AstraZeneca vaccine. And in addition, we have also used the Moderna vaccine to vaccinate over 11,000 people. Having done with the first and second phase, after our meeting in Lagos, which was summoned by the Executive Director, National Primary Care Development Agency. We are now back to the state trying to roll out the mass vaccination campaign, looking at the fact that that mass vaccination campaign was launched in Lagos, and all states are also to at least line up. And I want to believe Taraba State is also on course. We have just finished the state level training. Very soon we'll commence the local government level training, though there was some in-between activities, the non-polio SIA, which have affected the speed of our rollout for the mass vaccination exercise. But so far, so good. The rest assured, Taraba State will roll out the vaccination exercise, just like His Excellency, the Executive Governor of Taraba State, have been saying time without number that our people should at least present themselves for the vaccination. I want to believe we are going to ramp up the vaccination, and our people are going to benefit from this all-important COVID vaccination exercise.
Right. So, Mr. Hassan, what we have right there on the screen, if we could just go back to that, is something that the MPHCDA released earlier today, and it shows the performance of states towards vaccinating 50% of eligible people by January the 31st. If you can see right there, Taraba State is at the extreme right corner with the least percentage. So clearly, from this figure that we have from the MPHCDA, Taraba is actually the last in terms of ratings for states. What's your biggest challenge, really?
It's not sending any concern to us as a state, because we know actually that we have done so much. And that bar chart that was shared by National Primary Care Development Agency is not depicting a total holistic performance of state by state. It was only depicting the performance of state based on the rollout of the mass vaccination exercise, which was launched in Lagos. And it is true that many states, just like Taraba State, have not yet commenced the mass vaccination exercise. Some have done the state level training, some local government level training, while others have also commenced the vaccination exercise proper. In the case of Taraba State, that zero is not depicting anything, because yes, we are online and we are of course. We finished the national TOT. We are done with the state level training. Step down training for local government is ongoing. We have not done the flag up at the state and the local government level. I presume that is exactly what the ED is trying to say. It is not depicting the fact that best performing governors. No, it is not about that. It's about roll out for the first, for the mass vaccination exercise across the whole of the country. And I want to believe, just as I'm speaking to you, we are about holding a meeting with all the ESCs of Nigeria based on the invitation of a forum of the chairman of the forum, Dr. Addis. And definitely this issue is going to be in the front burner so as to discuss modalities on how to go about ramping up, looking at the fact that national have so much vaccines in their store, and states need to ensure that we improve our vaccination exercise to the benefit of our people and to the glory of God. Don't worry, be rest assured, next week when we meet, you will get a different result.
Okay, so Mr. Hassan, we have just about 30 seconds to wrap up. And I'd like you to confirm, or otherwise, if you have vaccines at every vaccination center in the state. Because, I mean, we had reports in the past that people went to get vaccines. Some had even gotten the first one, but they couldn't get the second one. So as we speak with you right now, are there vaccines, perhaps enough vaccines across the state?
Speak right now, the state have a total of 6,000 doses of vaccine. And we are working assiduously, and all the vaccines have been deployed to the local governments. And we are working assiduously to finalize all the levels of training, strategizing, because this time around we are going to involve the private health facilities, the secondary health facilities, market side, because UNICEF and WHO have already given us support, and indeed the state government, to ensure that we ramp up by creating corners, canopies, chairs, and what have you, where people will go and access the vaccines, instead of at least inconveniencing people. So we are working towards that. We have 6,000 doses. We have distributed all these 6,000 doses across the local government, and they are working on it. But definitely sooner than later, maybe before next week, definitely we are going to get more than 40 to 50,000 doses of the vaccine in the state.
Mr. Amina Hassan, we've overshot our time, but it's good you've cleared this up. We'd like to thank you so much for your time on the program. Mr. Amina Hassan is Executive Secretary of the Taraba State Primary Healthcare Development Agency. Thank you, and we wish you the very best. Well, let's head over to the foreign scene, where Germany has announced sweeping new restrictions for people who have not been vaccinated against COVID. Outgoing Chancellor Angela Merkel says unvaccinated people will be barred from many public places, including non-essential shops and events, unless they have recently recovered from COVID-19. Well, here's more on our global update.
According to the World Health Organization, Omicron has now been detected in at least 24 countries around the world. South Africa's National Institute for Communicable Diseases says more than 70% of all the virus genomes it sequenced last month have been of the new variant.
Africa has made little inroads in
the World Health Organization says it's deploying a surge team to South Africa's Gauteng province, epicenter of the outbreak of the new variant, to help with surveillance and contact tracing.
We are also working closely with countries to step up response to this new variant. In South Africa, where WHO has already a team working in genomic sequencing, we are deploying a surge team in Gauteng province to support surveillance and contact tracing.
Meanwhile, India has become one of the latest countries to report cases of the new Omicron coronavirus variant. The Health Ministry says the two male patients aged 66 and 46 years are showing mild symptoms and are under observation. India was to open its airports to all international flights from 15th of December, but that decision has now been suspended. Greece has also detected its first case of the Omicron coronavirus variant in a Greek citizen who had returned from South Africa last month. Officials say the man who has mild symptoms and all his contacts have been quarantined. In the United States, fears over the effect of the new coronavirus strain has risen after it reported its first case in a fully vaccinated person in California. The case returned from South Africa on November 22nd and tested positive 7 days later. And finally, over in South Korea, the country has reported a new record high of daily coronavirus cases. It comes as authorities hold quarantine exemptions for fully vaccinated inbound travelers for 2 weeks in a bid to fend off the Omicron variant.
Visit our website, channelstv.com, for more information and updates, especially better understanding of the pandemic, plus other stories all at your fingertips, like the U.S. confirming its first Omicron variant, Saudi Arabia, and the rest. Well, that's a COVID-19 update. Thank you for watching. I'm Kayode Okikiri. You stay safe.